Hi guys, welcome back to my channel. So today I decided to talk about pigmentation and approach it like in a holistic way in the little knowledge that I have. Pigmentation is one such problem that has been greatly flaring up among females who are especially 30 above and 40 above. Now, of course, I'm going to talk about one of the products that I've been using these days, if not for pigmentation, but it definitely does target pigmentation and melasma. That is tranexamic acid from Minimalist. But first thing, why pigmentation starts is, to my knowledge, is some internal damage that has been happening to your body. It could be because of excess of estrogen in the body, and the liver is unable to detox it, or something like that. Any other hormone imbalance or anything related to liver would show on face or on body in terms of pigmentation. When you have had hormonal imbalance for quite a long time, or somebody who's working in sun, in I see a lot of people in and around Telangana and Andhra with a lot of melasma here, and then they worry, and then suddenly they want to get it removed, and they go for lasers and all. They've been working in fields like, I'm talking about people, women from farmers community. For a very quite long time they've been exposed to sun. Not that every woman who's exposed to sun would have melasma, but anyone who has internally few issues that could flare up. I'm not saying that having melasma here is like threatening and all, but there's certain spots like age spots or liver spots. That is why the name liver spots. Somewhere you're on which part, suppose the liver is the palm, and if the liver has been damaging here, there is damage to the liver here, it might show up here. If the damage is here, then it might show up somewhere here. So depending on what part your liver is deteriorating, which part, I mean, that reflects on face. It has again some face mapping and reflexology techniques in Chinese and Eastern medicine, to show which part of liver has been in trouble and why you're pigmenting, etc. And forehead pigmentation may also be sometimes the reason for that, whereas the pigmentation around the mouth could be because of indigestion problem. So pigmentation is just not about superficial burning and superficial tanning, or pigmenting on the face. It definitely has its origin somewhere inside the body. What I see doctors and all suggest is, of course, topical cream somewhere to subside that and arrest the tyrosine, melanin activity, etc. But unless you concentrate, internally, if suppose you got a pigmentation here and then you're targeting it with laser, if not here, that laser is also nothing but you're wounding, so you're sending certain frequencies of radiation towards the dermis of the skin, and then you're wounding it. Suppose if the wound has formed this part of dermis and you're targeting laser on it, today it will be gone, but tomorrow the wound will go deeper, and then it will be difficult for you to remove. So lasers, I don't know, I'm skeptical about it. But if the doctor suggests, that's your discretion to go for lasers or not. But unless you use something to detox your liver, detox in the sense, of course, liver's job is to detox, but sometimes कुछ ज़्यादा ही हो जाता है that it's a burden on the liver. So in those conditions, maybe you need something like liver support, like N-acetylcysteine or milk thistle or dandelion. There are many supplements that are available. And once you take them for 3 to 4 months is when you start seeing there is a difference on your face or on your neck, etc. Pigmentation में थोड़ा फर्क you start seeing. When you do that, stop eating all junk and all, and try and have very peaceful mind by doing meditation or doing pranayama, etc. Then you could see some beautiful results. Topically, of course, earlier people used to suggest things like hydroquinone, which now abhi they are not doing it because hydroquinone is known to cause skin atrophy. That means the depth of skin cells in dermis. Particularly these days, people are suggesting the tranexamic acid. There are many brands which has tranexamic acid, and in combination, especially for pigmentation, I think Eclat has one, and pigmentation, of course, retinol works, vitamin C works, B3 works, everything definitely works towards pigmentation. But the reason why I picked up tranexamic acid is because tranexamic acid especially works for something called as PIE. Post-inflammatory hyperpigmentation is PIH, and post-inflammatory erythema is PIE. This beautifully works for that also. That's why I picked this one. But anybody who has spots in pigmentation, if you start detoxing your liver and having a good gut bacteria balance, you need to have prebiotic food a lot. And not probiotic but prebiotics, foods that have prebiotics, because your body has a different kind of probiotic, just like your fingerprints. It's not that, if you're taking probiotic supplement, everybody doesn't have the same set of bacteria in them. Just like your fingerprints are different and your iris is different, so your gut bacteria is different. So it is important that you give prebacteria and then your prebiotic, I'm sorry, and then let your body convert it into the kind of probiotic that it needs. That's the first step. And the second step is to detox, support your liver, and have a lot of semi-cooked vegetables or steamed vegetables for more nutrients for the liver support, and for especially the cruciferous to give that push to the liver. Else you can have supplements like DIM also. Estrogen balance from Palak Notes is one that I'm using for DIM. That will also help your liver detox excess estrogen and all of that. Now coming to tranexamic acid, this is quite popular product in minimalist, and many people have been reviewing about it and talking very good about it. This has turmeric extract, so that is why please don't use it in the mornings, and it has salicylic acid as well. So if you're somebody who travels for more than half hour in sun, then no. I travel just for 5 minutes, so for me it's okay. But if you have constant exposure towards sun, or you sit somewhere near a window where you have to indirectly at least face the UV radiations, then this product is not for you. I'll talk about why I have picked tranexamic acid. It's been exactly 2 weeks that I've been using it. In my previous videos also, I talked about higher testosterone that I've had, and because of that I'm facing acne and all. Now I'm on spironolactone, and as well as using good acne skincare. I'm using retinol very very sincerely, cutting off sugar, etc. So abhi the acne has come down for sure, but I have these red marks, if you can see. That is post inflammatory erythema, that is the acne scar, I mean marks that are left. So for that particular thing I'm using tranexamic acid. Now how it's working, I'm not saying it's dramatically and beautiful and all. First of all, it is sort of reducing the redness, and I'm also using the chemistry play niacinamide plus azelaic acid serum, which is also sort of helping me with acne. Overall, this is a good product, but for you to see results with it, you need to use 6 months at least to see some visible results, especially for pigmentation, following all the protocols that I've said just now. Um, and using it only twice or thrice in a week is recommended, because it also in a way targets the skin, and this is also very strong active, and so it is not recommended that you use it every day or every alternate day, maybe twice, or once you're tolerable you can go up to thrice, that too in the nights. And it's very hydrating, it's a beautiful formula. You can definitely try it for pigmentation. 6 months to 1 year is what it will take, along with some liver support supplement. Only then you can see some beautiful results for pigmentation. Thank you for watching.